mesothelioma. Call for the free book and receive so much more. Call 1-800-831-3700.
Any minute now, President Trump will begin unwinding Obamacare with the stroke of his pen. He is set to sign an executive order very shortly that will help trigger the biggest change to the nation's health care system since he took office. Under the new rules that he will be putting in place through an executive action, small businesses, some individuals, they'll have expanded access to cheaper plans that offer fewer protections. Groups will be able to purchase health care across state lines, this undermining, though, the protections that some people like about Obamacare. This, of course, comes after Republicans in Congress. They failed to make good on their promise for 7 years to repeal and replace Obamacare. Joining me now is one person who helped craft Obamacare, Dr. Zeke Emanuel, CNN contributor and former Obama White House health policy advisor. Doctor, thanks for coming in.
Good to be with you.
Thank you. So you helped craft Obamacare. You've also been very consistent in saying that the law needs fixing. Is what we're going to see today, is this the fix?
No, this is terrible, actually. So there are three parts to the executive order as we understand it. One allows these so-called association health plans to operate across state borders. A second expands the opportunity for short-term health insurance. The Obama administration had 3 months as the limit. That doesn't have to fully comply with the essential health benefits and other aspects of Obamacare. And the third is to change the health care reimbursement processes. What the executive order does is tell the Departments of Health and Human Services, Treasury, and Labor to relook at these regulations. The real worry is that, especially under these association health plans, is fraud. The association health plans have had a very checkered history. Almost every time we permit them, hundreds of thousands of people end up being affected because their bills are not paid. A lot of scam artists go into this because there's less oversight. And as you point out, some people will win. There's definitely some people who will get lower rates in small businesses that have younger, healthier workers. That means that some businesses will be adversely affected, and they will be have their rates go up tremendously. Because remember, what we're trying to do is create a big pool of people, and if you siphon off healthy people into another pool, you actually create a smaller pool, increase the risk that any one single person who gets sick will affect the rates for everyone.
But Doctor,
and it leaves older people.
In the interim, right? Nothing. Congress has done nothing to try to fix the problems with Obamacare. So, but are you saying, that this move is terrible, that doing something here is worse than doing nothing?
Yes, this is a case of where doing something is worse than doing nothing. There's many things. Look, we all want to get health care more affordable, premiums to actually decline. There's a lot of things we could do. The president's talk about drug pricing. There are other pieces of legislation changing how we pay doctors so they have an incentive to conserve money and not spend as much money when you can get to the same result. That's very important. Those will keep prices down much more effectively than this. Because while this will lower prices for some healthy people, it'll raise prices for older workers and people in small businesses that tend to be riskier businesses. It's not going to solve the problem at all. And remember, it affects a very small number of people. What the president's going to do today will affect maybe a few million people. It won't do anything for the 178 million Americans who get health insurance through their employers already. Mm-hmm. It won't do anything for a lot of the people on the exchange who are not members of franchises or trade associations. So this is more show than actual reality in terms of making healthcare affordable for Americans, and it undermines parts of the exchanges. And Donald Trump will own that if the exchanges see a big exit of healthy people and no longer can function. It'll be Donald Trump who did it.
And that is an important question going forward. When you put your finger on it, when you put your hand on it, when you've put your pen on it, is it now yours? You have also, though. Well,
he cannot blame. He can no longer blame. He will no longer be able to blame Obama. This will adversely affect the exchanges, and it's Donald Trump who decided to do it and explicitly did it.
You have talked to President Trump more than once, though, about health policy, and we know he obviously wants a legislative win. that didn't work. But what does he really want when it comes to health care policy in the country? Have you gathered that from your conversations with him?
Well, I think for political reasons, he wants something he can call repeal and replace. I think his real heart is in he wants to make it more affordable. And I have suggested to him, as I did to you, a number of policies that will make it more affordable. And that would be historic. Remember, bringing healthcare costs down would be a first time in history. And that would be pretty wonderful for the country and for Americans, not just in this small group of small businesses, but Americans writ large in Medicare, Medicaid, and those of us Americans who get our insurance through our employer. That is a much bigger challenge, but it's ironically something where there's bipartisan agreement. And what I think the president should focus his attention on, and what I've said over and over, is focus on where there's agreement. That's where we can push forward. What he's doing today is totally partisan. It's very fringe. It's opposed by not just liberal health policy experts like myself, but most conservative health policy experts think this is a bad idea, and it really doesn't solve the problem at all. And as I said, it may make it worse both by siphoning off healthy people, and this is an area that's going to be ripe for a lot of fraud and a lot of small businesses be affected by scam artists.
Dr. Zeke Emanuel, thanks for coming in. Let's listen to the president and see what he says in any minute now. I appreciate your time. Also, though, joining me right now, Republican Congressman Ryan Costello of Pennsylvania. Congressman, thank you so much for coming in.
Nice to be with you.
So you heard my conversation with Zeke Emanuel, but I do want to ask you about what the president's about to sign. You don't like Obamacare. You also, though, voted against the House health care bill in May because it didn't do enough to protect people with pre-existing conditions. A big issue for folks in your district. Are you happy about the move the president's making then today?
Well, I obviously won't know what is done until he issues an executive order. I did hear what Dr. Emanuel said. One thing I would add, though, that I do think is good, as I understand it to be, which is looking at the consolidation of healthcare systems across this country and how it may adversely impact patient access and patient protections is something that's going to be looked at a little bit closer. I think all Americans agree that we need to be concerned about that and need to get to the bottom line. Some of the other things Dr. Emanuel spoke to were sort of foreshadowing or forecasting why it might be bad. Obviously, I think I want to look a little bit closer at that. But the desire to reduce the cost of health care for Americans is a good thing. Obviously, in doing so, and one of the reasons I did vote against the health care bill was the concern that if we do erode patient protections, that's not a good thing.
What the president is signing is doing today, the regulation, what he's changing is one thing, but how the president is going about it is another thing, by doing it through executive action. Here's just a few of the times that the president himself has railed against executive power. Listen to this.
Obama goes around signing executive orders. He can't even get along with the Democrats. And he goes around signing all these executive orders. It's a basic disaster. You can't do it. I don't even think he tries anymore. I think he just signs executive actions. Nobody wants to listen to him, including the Democrats. So he just goes around signing executive orders.
How is this any different?
So, some good splices there. It's not different. Obviously, the president is going to issue an executive order which he feels will enable him to study and get to some policy reforms that would be good. Every president issues executive orders. The question, obviously, and you're probing it, is will this executive order be a good thing or not? That remains to be seen. Obviously, as a House member, these are the sort of things that you have to look at much deeper and get input from a number of different constituencies and stakeholders. That hasn't been done because we just received word of this. But my objective, I think, is the same as the president's and Dr. Emanuel. Make sure we provide patient protections, but also reduce health care costs. The devil's in the details.
It always is, and that's the tough bit. You still got to make decisions.
That's right.
That is the fact of the matter. You are co-sponsoring the House bill that bans bump stocks in the aftermath of the Las Vegas shooting. Paul Ryan just said yesterday about the whole issue that a regulatory fix is the smartest fix. Do you agree?
I agree with both, and let me explain. Number one, the quickest, most efficient, easiest way to get to the finish line on preventing bump stocks to be purchased the way they are right now is a regulatory fix through ATF. I also think, though, that if we're going to rely on a regulatory agency to make a fix, that regulatory agency in the future, as it did in 2010 here, could exempt it or could roll it back. And so legislation would be the final, full, most effective way of addressing this long term. That will take a little bit longer to do, which is why I think an intermittent ATF fix, as the Speaker suggested, is the right approach. But I still co-sponsor this bill, and I'm actually may introduce legislation myself, which would basically require that bump stock, if there is any legitimate reason for it, I need to be convinced of that, but if someone can convince one of that would at least have to go through the same process that an automatic weapon purchase would require. And right now that's not required, and that equivalency between taking a semi-automatic and making it automatic by purchasing something off the shelf doesn't make sense. And I think every American can agree with that approach.
You are also in a tough district for re-election. You said this week that you are not afraid of what made a lot of news, which was Steve Bannon's threats from the right, that everyone was under the microscope. But what are you more concerned about, a challenge from the right or the Democrats?
Well, look, I work hard. Anytime someone wants to challenge you, you have to evaluate that within the context of what you're doing and making sure you get your message out. To be perfectly blunt with you, I would imagine that a general election matchup would be more so. But look, if this is a time where a lot of very stridently pro-Trump voters want to see every member of Congress back fully the president's agenda and candidly leave their own evaluation and judgment at the doorstep, I won't do that. I was elected by 705,000 constituents. I need to look at everything issue by issue, speak my mind. When I disagree, speak out. When I agree, speak out, but explain why throughout the entire process. And I think a lot of members in districts like mine have to be more vocal. I'm starting to go on more television because I think my constituents need to hear weekly, if not daily, what I'm working on, why I think what I think about different things. And that's the approach I'm going to continue to take.
Congressman, just hold with me 1 second. I'm just taking a look at our monitor. President Trump is just entering the Roosevelt Room, where he will be signing an executive action, as you and I have been discussing just now, an executive action with regard to health care in our country. The Labor Secretary is going to be introducing him. Congressman, thank you so much. We're going to take our viewers now to the White House.
Americans have access to affordable health care. Mr. President, your executive order signed today is an important step in achieving that goal. I want to thank you and your administration for continuing to focus on finding affordable health care solutions. In addition to instructions given to the Treasury and Health and Human Services departments, the President will task the Department of Labor with considering ways to deliver quality, affordable health care to the American workforce. I'd now like to call upon Senator Rand Paul to say a few brief words. Thank you.
Thank you, Secretary Acosta. Today's a big day. President Trump is doing what I believe is the biggest free market reform of health care in a generation. This reform, if it works and goes as planned, will allow millions of people to get insurance across state lines at an inexpensive price. 28 million people were left behind by Obamacare, do not have insurance today. This specifically targets and will help people who don't have insurance or people for whom insurance is too expensive. I'm very glad to be part of this, and I really want to commend the President for having the boldness and the leadership and the foresight to get this done. And I'd like to introduce the Vice President of the United States.
Well, good morning. Secretary Acosta, Senator Paul, Secretary Mnuchin, Director Mulvaney, Administrator McMahon. Senator Paul, thank you for those thoughtful remarks. And to Congressman Greg Walden and Congresswoman Virginia Foxx, other distinguished members of Congress, and job creators. It's an honor to share this moment with you today. A moment where President Trump will take a critical step to lower the cost of health insurance for working Americans. Since day one of our administration, President Trump has made it a top priority to rescue the American people from the disastrous failure of Obamacare. Every day Obamacare survives is another day the American people struggle. and all the job creators gathered here today at the White House have witnessed the failures of Obamacare firsthand. Premiums have more than doubled since Obamacare went into effect, and next year premiums are set to increase even more. While costs have been skyrocketing, choices are plummeting. Next year, nearly half of America's counties will have only one choice of health insurance provider, which means they essentially have no choice at all. As the President and I have traveled the country, we've heard stories from small business owners like those gathered here today, from working families who are struggling under the weight of Obamacare. Today, President Trump will take decisive action to provide the American people with flexibility and freedom from the burdens of Obamacare and expand the number of affordable health care options for working Americans. And Mr. President, I can say I speak for everyone here and for millions of Americans when I say how grateful we are for your determination to repeal and replace Obamacare and your commitment, demonstrated today by this action, to provide the American people with more choices for more affordable health care in the 21st century. And with that, ladies and gentlemen, it's my privilege to introduce the President of the United States of America.
Thank you very much to Vice President Pence for that wonderful introduction and for the great job you do. And I want to thank Secretary Acosta, Secretary Mnuchin, Acting Secretary Hargan, and Administrator McMahon for joining us today. We're all gathered together for something I believe that's going to be very, very powerful for our nation and very good for a lot of people. But before I begin, I have an important update. Yesterday, the United States government, working with the government of Pakistan, secured the release of Caitlin Coleman, Joshua Boyle, and their 3 children from captivity from the Haqqani Network, a terrorist organization with ties to the Taliban. The Pakistani government's cooperation is a sign that it is honoring America's wish that it do more to provide security in the region. And I want to thank the Pakistani government. I want to thank Pakistan. They worked very hard on this, and I believe they're starting to respect the United States again. It's very important. I think right now, a lot of countries are starting to respect the United States of America once again. We hope to see this type of cooperation and teamwork in helping secure the release of remaining hostages and in our future joint counterterrorism operations. So with that, I want to begin by saying it's my pleasure to welcome so many great small business and association leaders to the White House as we prepare to make this truly historic announcement. And that's exactly what it is. We've been hearing about the disaster of Obamacare for so long. In my case, many years, most of it outside in civilian life, and for a long period of time since I started running and since I became President of the United States, I just keep hearing repeal, replace, repeal, replace. Well, we're starting that process, and we're starting it in a very positive manner. And I can say when you get Rand Paul on your side, it has to be positive. That I can tell you. Boy. Rand. I was just saying, as he's getting up and saying all these wonderful things about what we're going to be announcing, I said, boy, that's pretty unusual. I'm very impressed. But 7 years ago, congressional Democrats broke the American healthcare system by forcing the Obamacare nightmare onto the American people. It has been a nightmare. You look at what's happening with the premiums and the increases of 100% and 120%, and even in one case, Alaska, over 200%. And now every congressional Democrat has blocked the effort to save Americans from Obamacare, along with a very small, frankly, handful of Republicans, 3. And we're going to take care of that also because I believe we have the votes to do block grants at a little bit later time, and we'll be able to do that. Premiums have gone skyrocketing. But today, 1/3 of all the counties in America have only a single insurer selling coverage on an exchange, and next year it looks like nearly half of all counties in our country. Think of that. All of the counties, 1/2, will have only one insurer, and many will have none. Many will have absolutely created roadblocks for people to have any form of the insurance we're talking about. This is why in a few moments I will sign an executive order taking the first steps to providing millions of Americans with Obamacare relief. It directs the Department of Health and Human Services, the Treasury, and the Department of Labor to take action to increase competition, increase choice, and increase access to lower-priced, high-quality health care options. And they will have so many options. This will cost the United States government virtually nothing. And people will have great, great health care. And when I say people, I mean by the millions and millions. First, we aim to allow more small businesses to form associations to buy affordable and competitive health insurance. This would open up additional options for employers to purchase the health plans their workers want. I'm also directing Secretary Acosta to consider ways to expand these associations and these health care plans all across state lines. This will create tremendous competition and transformative, in so many ways, change aimed at creating more and lower prices for millions of Americans. But the competition will be staggering. Insurance companies will be fighting to get every single person signed up. And you will be hopefully negotiating, and you'll get such low prices for such great care. It should have been done a long time ago, and it could have been done a long time ago. This will allow thousands of small business employers to have the same purchasing power as large employers to get more affordable and generous insurance options for their workers. Rich and Leslie Baudry, where are they? Where are they? How are you? Nice to see you. How are you? Come on, get up here. Come on. How are you? Nice to see you, Leslie. They're here today from Louisiana, a great state. Just left. They had a little hurricane damage, they got hit like Charles. But we took good care of it, right?
Absolutely.
We took good care of it. They're great people. They're small business owners, and they know personally the benefits of association health plans, one of which used to provide health insurance for their employees. But after Obamacare, they were unable to afford their association plan. So they had a great thing, their employees were happy, and then it ended like so many more. I mean, this is something I hear. Greg, you know exactly what I'm talking about. Greg has been so incredible on this subject, and people had plans that worked, and then all of a sudden they were just totally cut off, and happened to your company also. Rich and Leslie have said that they would love, once again, to use an association health plan. And there are millions of Americans who want more affordable options just like them. And now, with this executive order, Americans will likely soon have those options. We will be very happy to provide them to you, and you will be very happy, Rich. I think you're going to be extremely pleased. If you're not, you can tell them right now. Okay?
Thank you so much.
Thank you, Leslie. Appreciate it.
Thank you.
Great to see you. Thank you very much. In addition, my administration will explore how we can expand something called short-term, limited duration insurance. These health insurance policies are not subject to any very expansive and expensive Obamacare coverage mandates and rules. The cost of the Obamacare has been so outrageous, it is absolutely destroying everything in its wake. They were so attractive that just last year, the previous administration crippled the market in an effort to keep people from fleeing the failing Obamacare plans. In fact, they prevented these plans from lasting more than 3 months. They will take action to fix that. and to make these affordable, flexible plans much more widely available. So we're going to have a very widely available plan that's going to cost much less. And from the standpoint of the United States government, we will be very happy, won't we, Virginia? We will. So they'll get better, and it will cost us nothing. That's not too bad, right? We need some more answers like that. Finally, today's executive order instructs Secretaries Acosta, Mnuchin, and Hargan to explore how they can allow more businesses to use tax-free health reimbursement arrangements, or HRAs, to compensate their employees for their health care expenses. Currently, only about 1/3 of small business employees receive coverage at work, forcing millions of workers to enroll in the exchanges or remain uninsured and to pay the individual mandate penalty. Not good. Not good. That is one of the most unpopular things I've ever seen in government, I can tell you. This order takes first steps to make it easier for businesses to help their workers afford high quality and more flexible health care through reimbursement accounts. With these actions, we are moving toward lower costs and more options in the health care market, and taking crucial steps towards saving the American people from the nightmare of Obamacare. Today is only the beginning. In the coming months, we plan to take new measures to provide our people with even more relief and more freedom. And by the way, on another subject, that will include massive tax cuts. We are going to get massive tax cuts, and I believe even Senator Rand Paul, and I know Virginia, Greg, I think you're with us, but the whole country is looking for these massive tax cuts, and we will get them. And we are going to also pressure Congress very strongly to finish the repeal and the replace of Obamacare once and for all. We will have great health care in our country. Thank you all very much. Appreciate it. Thank you. Thank you. Thank you very much.
All right, President Trump right there, as he was announcing that he'll be signing this executive order with regard to healthcare policy in America. He'll be sitting down at the desk right next to that lectern. He'll be signing that executive order. Looks like maybe he was about to leave, and now they're directing him back to remind him. I'm just trying to listen in. All right, so President Trump, let's listen in while he makes it official.
Promoting healthcare, choice and competition all across the United States. This is going to be something that millions and millions of people will be signing up for, and they're going to be very happy. This will be great health care. So congratulations to everybody. Thank you. Thank you, everybody.
All right, and there you have it. President Trump